guys, welcome back to Medical Coding with Blue. Today's episode is all about interview tips for first-time medical coding job seekers. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so maybe you've gotten past the, okay, we're reviewing the resumes, now we're gonna invite you in for an interview. Maybe you're to that phase already. This is probably one of the most nerve-wracking parts of the interview process because this is your first meeting, your first time going in and talking to the folks that you may be working with, right? And sometimes you are being interviewed by one person, sometimes you're being interviewed by a panel. So always kind of go in there anticipating that you're going to go before a panel. Most times that I have heard from other folks that they've been interviewed by a panel. I have been interviewed by a panel a couple of times, and then once I have only been interviewed by the person. It was just me and the person. So it's going to be a variety of whatever and wherever you're applying. So just something to keep in mind. But the thing that you need to go in with is having the right attitude. Keep in mind that these folks are probably just as nervous as you are. So go in with the thought that you're meeting a new friend. When you have that, as silly as it may sound, when you have that in your mind, it's a lot easier to be calmer around people that are going to be your friends, right? You're just putting yourself into that mind frame, okay? This is not that you're actually going to be besties, because some people just don't connect outside of work with other people, and that's okay. It is okay. But you want to just go in there with that mindset to set yourself up for success. The other thing that you want to be prepared when you're walking in there, you need to know about the company, about the hospital, where you are applying. You need to know something about the organization itself. Because if they ask you, why do you want to work here? You don't want to sit there and say, well, you guys are hiring. That's why I applied. Then that shows somebody that's not really interested in wanting to work at that organization. So you really want to do your research and find out something special about that organization that will make you stand out to those people, you know, the panel or the single person, whoever is interviewing you, okay? When you go into this interview, make sure that you are well dressed. Now, I'm from Texas and we say Sunday best, but basically you want to be in a nice professional outfit. You want to go with something like earth tone colors, greens, blues, browns, blacks are fine. You really kind of want to stay away from the loud, flashy colors and things because you want to show that you are serious, and you want to show that you want them to pay attention to you as a person, not as, oh, what she was wearing or what he was wearing. So we want to make ourselves be the star, not our outfit, okay? Now, yes, you can love clothes and shoes and all that kind of stuff, but you really want to make sure that you are looking professional and that you are well dressed. You never, ever show up to a interview for medical coding in jeans. I don't care if they're dark wash. I do not care if they don't have holes. You never, ever show up in jeans, period. There's no excuse for it. And for my gentlemen out there, there is no excuse to show up in a polo shirt either. You need to be in a button down. That's just the way that it is. You know, you don't have to go a full on jacket, but you do need to at least have a button down shirt. At least that's just what I would recommend anyway. Slacks are great. For ladies, skirt, dresses, or slacks is great as well. But you want to make sure that you are in your Sunday best or your best professional outfit, okay? And you want to make sure that, again, that outfit is going to say to them, this person is very serious, and that's why they're here. Another thing, too, no cologne, no perfume. You do not want to go into that interview and be remembered as the person with the obnoxious smelling perfume or cologne. Period. There is no excuse for that because you consciously have to put that on. So even though you say, oh, I only put like one spray, that one spray may offend somebody as far as like their senses, and all of a sudden they're sneezing and this person, you know, it's too strong and things like that. You want to get the job, guys. You want to get the job. And yes, everybody wants to be an individual, and I understand that. But in this interview process, You want the star to be you, not what you're wearing and not what you smell like. Okay, so that's the thing that I hate to have to say that, because some people will be like, really, Blue? But trust me, if you pay attention to the details will tell you everything. Okay, so that's just what I'm saying there. Okay, but with that said, you also want to be able to speak clearly when you are in this interview. If you tend to speak low, especially when you get really nervous, you need to work on that. Work with the mirror, or work with a friend, or work with a loved one, somebody who you can practice speaking back and forth with. Okay, somebody that you can make sure that you're enunciating your words, because when you are in that interview, you don't want them to say, "What'd you say? What was that? I didn't understand you. Say it again." You don't want them to have to say that to you. So always speak clearly and claim your place at the table. You may see those little clips on Instagram where they talk about claiming your space at the table. It is very true. The person who's laid back and lackadaisical and is really kind of withdrawn at the table whenever they're interviewing, whether you are in person or through Zoom, if you are laid back, that's going to show that you're not really interested. The person who's leaning forward and is engaged in the conversation and is looking at everybody is the person that's going to stand out. This is a person who is professionally ready to work with us. That's what they're looking at as well. It's not just, can you pass this test? Can you answer these questions? They're looking at your behavior. They're looking at how engaged you are, okay? And just remind yourself, everybody is nervous. Everybody gets nervous. But sometimes people have a way of kind of compartmentalizing, and they're able to keep that to the side while they're doing this interview. So just always think of that, okay? Just make sure that you know that, because that might give you a little bit of comfort, when you think about it. Now, the other thing is, you need to ask them questions. The worst thing that you can do as a medical coding candidate, right, going in there for this interview, is when they ask you, well, do you have any questions for us? And you say, no, I think we covered everything. I don't care if you have to come up with some weird off-the-wall question to keep the conversation going. You need to ask at least 5 to 10 questions on your own that was not related to what they talked about, but you need to come up with 5 to 10 questions on your own so that you can show engagement. Now, I would prefer somebody do 10 questions, but that might be a lot for some people. But at least show a good effort that you are trying to learn more about what is here. What would you be doing here? You can ask, if they did not cover this, what clinic would you be assigned to? What are the opportunities for moving around to different clinics to help support other coders? Is there cross-training available? Okay. What does the audit process look like? Are you audited monthly? Are you audited quarterly? Are you audited twice a year? Those are the questions that you need to ask, because these questions are very important, especially when it comes to the auditing, right? You need to know how many records are being audited when you are being audited, because that's important. Because if they say, oh, well, we only audit you on 10 and you do over 2,000 in a month, 10 is a very small number, and that's quite unfair because when you think about it, that's really low. And if you miss one thing or two things, that's, your numbers are in the toilet, And so that's the thing. You want to make sure that you ask them. What is the productivity standards? What are the accuracy standards? How high does the accuracy need to be on average per month? Some places you have to be over 94%. Some places it's at 95%. My facility, we are at 97% accuracy or higher, okay? So that's the thing. It really all depends on the facility. But ask them those questions, because accuracy and productivity are the way you're going to be able to keep your job, okay? Ask about continuing education units. Do they offer them there? Is there classes that, go on every month for those situations? Or are they given a stipend there at that facility? Some facilities will do that. Some facilities will have continuing education units given every month. Is usually like one, 1.5, sometimes 2. It really all depends. And so then you get those, or some facilities will say, no, we give you a stipend every year so that you can get your CEUs on your own. And some say we don't give that at all. It's your responsibility. So it really, again, it all depends, So ask them. Ask them if you're working from a work queue. If you are working from a work queue, this means you are working from a shared pot, and there's going to be a bunch of coders who work from this same pot, and everything's lined up, and then you're going to go through and you're going to pick a record. Somebody else is going to pick the next record, and the next person picks the next record. But sometimes coders will skip. Now, people will say, oh, no, we don't skip at our facility. But trust me, there's ways that coders learn after a while how to skip and not get caught. All right. That happened to me when I worked for Level 1 Trauma Hospital. I had coworkers. We were all working from a queue, which was why I will never work in a queue situation ever again. But we were working from this queue situation, and they were skipping all of the hard stuff, and I was getting left with it. It's okay because I ended up becoming a stronger coder because of it, so I was fine with it. However, I had to explain this to my boss so that she didn't think that I wasn't trying to code as much as I was supposed to code at, whenever I was coding. So that's just something that you have to keep in mind. The other thing is, when I said, are you assigned to a clinic? Sometimes in these clinics, you're assigned a partner, and it's like 2 people. Sometimes it's 3 people, depending on how big that clinic is. Sometimes that's the way that it is for like the emergency room. There's a group of coders that code for the emergency room because the emergency room is open 24/7. So they are getting encounters all the time. And so that's why there's so many emergency department coders. So ask that question if you're going to be working with somebody, okay? Find out who you answer to. What is a chain of command? Usually the way that it is in these facilities is you go to your lead coder, or sometimes your lead coder, they don't have that. They have a supervisor, coding supervisor, and that's who you go to. And then after the coding supervisor, it's the department chief. And then after the department chief, it goes up and up. But, that's the thing. You have to find out what the chain of command is. And so those are the things that you want to ask. You also want to see, are there opportunities to go to conference? The industry has conferences every single year. AHIMA, the American Health Information Management Association, and the American Academy of Professional Coders both have their annual conferences. AAPC, the American Academy of Professional Coders, has several throughout the year. AHIMA has their state conferences, plus they have their annual conference every year. So ask if that's part of the thing of working there. Do y'all go to conferences? You can ask that. You're just asking questions, and you're just trying to make conversation. That's all you're trying to do. You want to get to know them. You want to be able to connect with them, all right? And pay attention, especially if you're in somebody's office. If you see something in somebody's office that, maybe they like a certain team or whatever, and, maybe something about that team, great, say something. Or maybe they have their diploma up and you know about that school, say something about the school. You want to get that connection going. That's what an interview is. But don't look at every interview like, oh my gosh, this is make or break, and if I don't get this job, I'm never going to apply again. You are going to keep applying. Because even though you go into this interview and it goes fantastic and everything is great on this interview and you're really excited, it doesn't need to stop you from applying at other places as well until somebody gives you an offer. You are a free agent until somebody makes an offer. And even still, you might be given 2 offers at the same time. That has happened several times to several of my clients. And I've gotten several of those emails where they say, Blue, I just got an interview and it went really great, and I think they're going to make me an offer, but they have to get back to their people, and then they write me again and they say, well, Blue, I just got another job interview. Should I go? Heck yes. You don't have an offer on the table yet. Just like they have free will and free choice to pick whoever they want to, is the same thing for you. And at the end of the day, you need to look at which which place that you want to go to that's going to give you the most benefit. All right. You're not loyal to anybody until you start working there, obviously. But even still, if you know that they're paying under what the Department of Labor or the Bureau of Statistics says, and you can go there to see what the starting salary is for a medical coder in your area. Please don't ask me for the link, guys. Don't ask me. Go to the website and look it up. But if you do that, right, and you say, okay, well, I know they're paying under, let me try to go apply for another place, you can totally do that. Even if it's been just a few months, that's okay, because in the beginning, it's normal to move around, all right? It is, but don't move around to chase the money. If this place that you're working at, if you know that there's opportunity for growth there, you need to consider that before you jump ship and you go someplace else, right? Again, you don't want to chase the money, because the money will be there. It's just a matter of going to the place that's going to give you the most experience. If you are coding for a place where it's the same thing, the same mundane things over and over again, and you're not really learning, you've noticed that, then it's okay to apply someplace else, because you don't want to get rusty on anything. You don't want to get rusty on evaluation and management leveling. You don't want to get rusty on coding for CPT or diagnosis coding. You don't want to get rusty only coding only a certain thing. All right. So that's why I say, if you're going to start off in risk adjustment, you need to be very quick about risk adjustment. I think it's a great place for coders to start, but it's not a great place for coders to stay. Now, with risk adjustment, you got to be careful, because this is just diagnosis coding only. There's no evaluation and management, and there's no CPT coding. Now, before you get excited, there are some employers that will not count risk adjustment as experience. That's why I say keep the time there short. Use that time that you're going to be in risk adjustment. Use that time to learn about the electronic medical record. That's going to go right on your resume under your skills, okay? If they use Epic, if they use Cerner, if they use eClinicalWorks, that can go there. If you use the encoder, that can also go there. 3M encoder, all right? These are little skills that you're picking up along the way that can flesh out your resume, guys, based on what you learned there, and also, of course, what you learned in the school. So there's all those things that you can do when you're out there and you're applying. And when you talk about the things that they may ask you, tell us about your school experience. If they know, they're gonna know that you don't have experience. And if you tell them, tell us about your school experience, this is not the time to complain about your teacher didn't teach you, and that you had questions and no one taught you, and that you taught yourself. It's not the time for that. This is a time to show, what did you learn in the school? That's what they're really driving at. But they want to see if you're going to complain. Because at the end of the day, guys, people don't like complainers. People who are always the victim and always have to say, oh, well, I didn't learn this in the school, my teacher didn't teach me. We know, because there's a lot of these awful schools out there that will pump people out and call them medical coders, and then they're not prepared for the real world. But if you say, in school, I learned the art of discipline when it comes to time management. Talk about that. Talk about how you spent 20 hours per week studying. Talk about how you went over the coding guidelines, how you watched videos, and you changed the mediums that you were learning through. It was print, it was video, it was audio. These are the different things that you can say that you did, and that you learned more in depth about certain subjects that you struggled with. You worked hard to learn cardio. You found ortho to be interesting, but you had to really deep dive into ortho. But you learned XYZ. That's when you start talking about, well, I did some more practicing through the workbooks, and I'm just so excited to be able to apply this knowledge here. I'm excited to be able to put my skills to use. And if they say, well, we want to go with a different candidate or whatever, or if they say, well, you don't, at the end, maybe you don't have enough experience, and maybe you should come back when you do have experience. it's okay to be disappointed, but don't be disappointed right there in front of them. Just say, well, okay, I understand, but thank you so much for meeting with me. This has been great, because this helps me to practice on my interview skills, obviously. But this is great that I could meet with you, it was a pleasure meeting all of you, both of you, whatever. It was a pleasure meeting you, and I look forward to seeing you again someday when I get more experience, you know. And it's okay to have that. It's okay to be like that, because they're going to remember that. And they're going to say, well, you know, they had a really good attitude. And maybe whoever they pick, maybe they didn't work out. And they say, well, you know, let's go see if this person, you know, still needs a job. We'll bring them in, you know. Not really what you want, right? But it may not be what you want. But then you are in control of saying, you know, I found another job, or, you know, I have this opportunity elsewhere. It's okay, guys. They understand. It's just a part of the industry. You know, that's part of the way that it goes. But it's not a reason to be down. It's not a reason to give up. It's not a reason to do any of those things. It will come to you, but you have to be as engaged with it. And yes, there's going to be a lot of rejection. Yes, there will be a lot of rejection. Be prepared for that. But again, it's about being positive. And before I wrap this up, I want to say this. Do not go on LinkedIn and beg for a job. It is gauche. Not only that, this is a small industry, even though there are thousands of us. It is a small industry, and you will get a reputation. I saw somebody post a picture of themselves and their kids, and they were like, it's not just me looking for a job. Like, why would you do that? Don't do that, guys. Do not do that, because that's not showing what you need to show, which is your intelligence and your ability to be able to do the job. I don't know that person. I don't know what their resume looks like. I don't know why they're not getting called back. But I do know that putting your family out there, like your pictures with your kids and stuff like that, it's manipulative, and there's no place for it in this industry. Don't do it, guys. Don't do it. Don't beg. Do not get mad. Do not say, I'm mad. I've seen those before too. And they think that that's okay. These are not your friends on LinkedIn that you can just go and share all of your emotions with. These are professionals that are going to know who you are, and you're going to gain a reputation if you do that. So make sure that when you go into these interviews, that you're going into these interviews with a good mindset, and that you want them to remember you, not what you look like, not what you smell like, and certainly not how you act on social media. Okay, so that's just what I'm going to say there, guys. It is a tough road, but once you do get in, you're in. All right? Don't give up. Always look for alternative positions as well. You can look in the revenue cycle. You can look at prior authorizations. These jobs are not going to be forever, okay? This is just to get you started and to get you some exposure. I've done plenty of videos on alternative jobs that you all can watch, but I just want to kind of stick with the interview tips on this one. Have a positive attitude is really what it all comes down to, having that positive attitude. But just make sure that you keep applying. Do not give up, guys, okay? So best of luck to you out there. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.